Hi, everyone, and welcome back to the Vagina Healing Podcast. My name is Takira, and I am a dietitian that helps women to heal from chronic vaginal infections. I've healed myself twice from chronic vaginal infections naturally without strict dieting or medications. I've healed from yeast, BV, mycoplasma, and ureaplasma, and now I teach women how to do the same using holistic approaches. On the podcast today, I have a functional medicine gynecologist named Dr. Christina Enzmann. So, welcome to the podcast.
Thank you, Dakira, for having me. I'm all excited. Let's talk a little bit vagina today.
Yes, thank you. I'm excited also. So, guys, before we even get into that, I'm Dr. Christina. If you want to explain who you are and how you got into this field.
Yes, absolutely. So my name is Dr. Christina Enzmann. You can hear it. I'm originally from Germany, but have been living for like over 20 years in the US. Um, I really have my PhD in dermatology. So I just always tell these people, so we understand I've been used to looking very closely at the skin. I always loved that. So once, I started my practice in the US, it was always natural to me to really have a good look at the vagina, probably, much more than other people do at the vagina, at the vulva. So skin is really that thing that always interested me. And then the other thing I did in my PhD, it was really about it was in a way about microbiome. So when I did that, like end of the 90s, talking about the microbiome was really a very niche thing still. However, I back then already knew there's a correlation between, bacteria and, how clean we are, not in a good way, and autoimmune disease and, like atopic dermatitis, which is eczema. So that thought about the importance of the bacteria has always been planted in my head already. So now I was in practice, and these women came to me, with all, the odor. You've talked to your clients about it, the odor and the itching and the irritation. And what was very obvious to me is that, people or women use more and more, cleansing products, the more irritation or odor they have, and things always get worse. So that was the one obvious thing. And then I knew from my studies about, microbiome, I knew that bar soaps is a big disruptor of the cell-to-cell adhesion barrier in this very delicate vulva and vaginal area. And we also knew, or I did know, that bar soaps, like the soap scum, is a really big problem because it feeds the wrong bacteria, right? Because if we think
Yes.
about the vagina, you need to, it's a balance act between yeast and the bacteria. So if you feed the wrong bacteria, that's when you can really never get rid of BV in my clinical experience. So that is the first thing I always do. So I think it was really that. And um, that the importance of that really the vaginal balance and not, I mean, the microbiome balance and not eradicating these bacteria. And now it's much more common, but like over 20 years ago, people were laughing in conventional medicine if you were talking about microbiome, right? Now these days, every regular gastroenterologist, puts that word in their mouth, even they might not really know what that means, and prescribe probiotics. So I always resisted that thought that, the vagina is this, and it's also cultural, right? So this vagina was always, I always said like it's this dirty black hole, right? So you have to
Yes.
cleanse it, right? And, if you look at old ads from the bar soap, it was always like, scrub it and make, and that women come with that mindset still, like you have to read it's something dirty. So I think this was really where I was immediately saying like, no, we need to change this because this is not right.
Yes. I love all of that. And I love that you also started off in dermatology. And since we were on that topic of skin health, and you mentioned how soaps can disrupt the lipid barrier and the skin barrier, can you explain why over-the-counter like vaginal hygiene soaps and vaginal hygiene products, how is this disrupting women's vaginal microbiome, and why is it not working in the way where they think it's working?
This is just the worst stuff really ever. So everything, that's marketed to you from Johnson and Johnson and Procter and Gamble, I think people just have to understand this is still all formulated first on this old thought, it's the vagina, it needs to be cleansed, so there are disinfectants, then there are and antifungals, have their role sometimes, but you shouldn't just be using that non-discriminatory. Then there are the topical anesthetics, like lidocaine, so for itchiness. So you can just buy that stuff and apply it liberally. And it has its role sometimes. However, it's also one of the ingredients we see the most local skin allergies, actually, tremendous, toxic skin reactions. So if you do this forever, you see really wild things. The other thing I think none of these companies really, it has maybe also to do with regulation, that no one takes into account that our vagina is it's not just like outer skin, it's mucosa. So really things you put in there are really absorbed really fast, that then that mucosa has barely chances to defend itself. So I see many skin irritation from things like Monistat, over the counter antifungal. Women buy it, and then they come and they say, well, it's getting worse, or usually it's getting worse and it's still itchy. And then I look in the vagina and there's no more yeast, but now you basically have this angry vagina, I call it. It's basically irritated from the other ingredients in these products, often the cream, the emulsifiers, and whatever they use. So I just think the regulators and the manufacturers haven't, they for inconvenience, who wants to deal with that vaginal reality that this is not just skin. However, you have to know this as a listener, that this is like, I always say, remember, we can give like many medications we give rectally, right? Because it directly absorbs. The vagina is kind of the same thing, like literally. So be very careful, be very gentle with your vagina. It's a miracle. It's a real hole, it's like an oven that can do so many things, have a baby, keep the baby safe, so many things. But man, don't put stuff in there you don't know, where it's coming from. So many people come, have they see something on TikTok, and then they say, oh, this is great, and so much skunk is coming out once I put this in there. And I'm like, of course there's stuff coming out, because your vagina is screeching like, what are you putting here in me? All the bacteria are literally coming and trying to get rid of that. So anyhow, I answer your question? I always get very passionate about.
It's okay. You did answer the question, but I wanted to answer this more detail for the
Yeah.
viewers on how these vaginal soaps over the counter, like Summer's Eve and stuff, how they're not differentiating between good and bad bacteria. So they can
Yeah.
also be cleansing away the good bacteria on like the skin microbiome and cause more odor down the line and cause more
Yeah.
irritation to like the vulva area.
Yeah. So the bar soaps is, my particularly one. So the bar soaps are really, and there are Syndets, of course, but, really the bar soaps, even when they're the Syndets, which are not really with soap scum, but they have some other residue. And then, the other thing people come, oh, I use an organic soap. And I like, that's great that you have an organic soap. It's still soap scum. Like in Germany, we use like these bar soaps or castile soap. We use that for our floors. It's a great cleansing product for
Yeah.
appliances, but for the vagina. So for the original soap, the pH is really elevated. However, so that disrupts that. We don't have that with the synthetic cleaning bars. However, so they're kind of still stripping, right? So they're disrupting the oils on your skin because it's cleaning, and then they are putting, particularly when they are like saying they have this lotion effect. So then they're putting artificial fatty acids back on your skin, and these basically feed the anaerobic bacteria that's causing you recurrent BV all day long. And the other thing I want to add there, it doesn't matter if you just use that soap them on the rest on your body and not in your genital area. So I have this a lot. I tell you have to stop using that. And then they come back 3 months later. Yeah, but I don't use it down there anymore, just for the rest of your body. I'm like, yeah, this is not really going to help, because it's a continuum hour. It's not, the skin doesn't stop like at the vulva and then this is now the belly button. That doesn't matter. So that is the one. And the other thing is, so there are studies, they're older, when I did my PhD, that basically showed that the soap scum disrupts the cell-to-cell adhesion barrier. So this is basically how the cells connect to each other. So if you wash a lot, rub a lot with your washcloth with bar soap, you're going to have more yeast infections. That's what I actually see, additional to the odor. But yeast infection is actually also caused by these Syndet use, bar soap use, all of that. Um, And then again, chemicals, right? So when you're now saying, well, let's talk about moist wipes is the other thing. I haven't seen one moist wipe that I would recommend. They have all things in there. They're just, again, I told you, directly absorbed through that very delicate skin. Uh, it can irritate every skin. And the other thing is perineal pads, so menstrual hygiene pads. So they
Yeah,
actually are shown, to emit toxic fumes. So one of the major brands are literally, it's terrible. Women break out and they can't understand that there's indeed a relationship. All right. So you ask about the, sorry, did I answer your question? I'm just gonna
oh,
ask
you
about.
did. Yeah. Because I was just wanting to explain to the audience how these soaps can disrupt like their
Yeah.
skin pH, but you pretty much described it already. So that's good.
Yeah. Well, because
Yeah,
the
so
pH, is only one thing, because then, there are all these modern soaps. It says pH balance. Yeah, that is still not going to help if it's, a synthetic cleansing bar. So it's not
exactly.
all about the pH. There are many other things that really go into that equation. Yes.
Yeah, exactly. And I agree. Okay, so before we continue into the actual topic, if you want to explain what makes you different as a functional medicine doctor and why a lot of GYNs can usually help their patients solve vaginal infections.
Yeah, I think, that these vaginal infections, they are just not well. There's no good teaching regarding it, right? And this conventional, thought, again, it's about this vagina is this, this potentially bacterial laden uh, how do you say, area in the body that if there's like an infection, right? Even if it's just a bacterial imbalance, we need to treat with antibiotics. This is just, if you have a hammer, everything looks like a nail. That is really the problem. And then there is no teaching, no knowledge about, well, what do I do if this keeps coming back? And there's just no good answer. It's just, oh, we treat again, right? With the same thing or a little variation of it. So I think there's this. And then at some point, these patients, I think, if you have a busy practice, and I think that's also part of it, it just gets like, the practitioner gets kind of fuzzled. Like, what am I doing? There she is back, same problem. Okay, here, take another prescription. And I think also sometimes practitioners might think, well, if I give a prescription, the patient is happy. However, I think sometimes if we just would explain things a little bit better, they also would be happy if you don't give them a prescription. So I think that's really the problem. There is no, no algorithm, no teaching module about what that really is and why it happens. However, I do think as we know or acknowledge more the existence of the microbiome, we acknowledge it more in the gut, and I think, in the vagina, that thought is going to spill over. Like this needs like a different approach. And, we know, smaller companies, we have the vaginal probiotics. So I think it's going to get better, definitively. But you ask me why this is, and that's why that is. And, it's just like, and there's really no specialty for that, right? Gynecologists, they deliver babies, they do surgeries, right? These chronic vexing, skin issues, they don't know. And of course, you can't really go to a dermatologist with that. These are also going to say, like, no, this is really not my
Yeah,
area. So it's a little stepchild that needs to be adopted, I guess. Oh, and
yeah,
you asked about the functional approach. So I think where I'm
yeah,
really different is that I'm not the antibiotic prescriber. I do it initially or if we need it, but I always think about, and that is the functional part of it, like what is actually underlying? Why are we getting this? Not, oh, this is there, let's get an antibiotic. It's always like, well, what is actually why? Why? Is it the bar soap? Is it some other things? Is it irritation? Is it allergies to something. So that's where it's different. And I think that I, think a lot about really that microbiome that I always thought we don't want to bump this all away. I'm always thinking like, no, we need to protect it. How can I stabilize that? So I think this is how it really started. And then of course, I'm using many of the functional medicine armamentariums, which is I describe it as a toolbox that we're not being taught about in conventional medicine. These are just specialty tests that can dig really deep into the microbiome of the vagina. but also the gut. So gut we started out, and I always argue this is kind of if we have like a leaky gut, like like if we know that the gut barrier gets compromised by certain things, I'm like, well, this is exactly what I see in the vagina too. It's when someone can't use no more products at all because everything burns, I'm like, well, this is a compromised vaginal protection barrier, mucosal barrier. So that, and then I also do food sensitivity testing because sometimes this toxic skin eruption or like these skin lesions on the vulva that don't change at all. Well, guess what? Sometimes it's literally a food sensitivity. So I look at these things and really take every insight I can get that helps me to understand what is really underlying and how to fix it long term without prescribing antibiotics all the time.
Yes, so that was really, really great. Thanks for answering that. So, guys, when you are looking for a healthcare provider or a GYN specifically who will spend more time getting to the actual root cause of whether it's your vaginal infection or your vulvovaginal disease, you want to look for a functional gynecologist like Dr. Christina, who can actually run more in-depth testing to help you get to the root cause because a normal conventional GYN most likely usually will not be running the testing that a functional GYN would because functional doctors and practitioners are trained to get to the root cause. So if you're frustrated with your conventional GYN, then you can check out Dr. Christina or other functional GYNs as well. So now to get into the actual topic, which is vulva vaginal disease. So we know BV, yeast, AV, CV, all of those vaginal imbalances that can cause like odor and discharge and stuff. But what's not as talked about are the vulvovaginal diseases like lichen sclerosus, lichen planus. So if you can first explain what even is a vulvovaginal disease, and if you can give examples of the most common ones that you see your clients deal with.
Yeah. So, vulvovaginal disease is basically, it's an umbrella term, really, which encompasses all the autoimmune vulva skin condition. It does include the dysbiosis, so it does include BV and yeast. So don't get me wrong. But so to expand, what else can happen to the vagina? So I know you've been talking about BV and yeast, so your listeners know about that. So there are other things. For example, genitourinary syndrome of menopause. So we called this in the past vaginal atrophy. This just means the vagina is used to a certain amount of estrogen, and as that goes away, as we got older, these tissues become thinner and more fragile, and they are less stretchy, less pliable, less moist. And with that, because the estrogen is lacking, the cells change, so they're not as glycogen rich. And with that, the vaginal microbiome changes, which is, by itself, nothing bad. But you're not going to find the abundance of lactobacilli in, let's say, in the vagina of a 60-year-old. And I think that's where often things go wrong with in the gynecology PR because they're like, there's no lactobacilli, and they're like other bacteria, you have BV, telling the 60-year-old. And I'm like, no, she doesn't have BV. She might have something that looks like BV, but she probably has a postmenopausal normal vaginal microbiome. And if you give this lady now lactobacilli without giving her estrogen, it might actually burn because lactobacilli are acid forming bacteria to protect, the younger vagina, I want to say, from other bacteria. So that is that genitourinary syndrome of menopause, which not every woman is getting that. I think I always have to, now that there's so much social media out of there and people all think they're all going to get osteoporosis or all going to get this without estrogen, nature is interesting. So yes, I see vaginas, they have clearly they don't have much estrogen. The skin looks very pale, not as pinkish. However, they have no pain with intercourse. They say there's no issue, there's no tightness. So, and there is, conversion of estrogen on the cellular level. So we are all a little different. However, many women do get genitourinary syndrome of menopause, which can be mild to more severe from urinary frequency and urgency or recurrent urinary tract infections. That's why the term is called genitourinary. Um, and to, the vaginal dryness and pain with intercourse. And the good news is, however, all this can be treated with topical, so vaginal estrogen, which is not the same than systemic HRT. So we can talk later about genitourinary syndrome of menopause because I know there are other things you want me to talk about. So the other thing would be For example, lichen sclerosus. That's another very common one. That is a condition now that really needs to be, you have to make sure that this, it can be confused with genitourinary syndrome of menopause. It can be confused with yeast infection. So that's why that's really important. So that is kind of an autoimmune reaction. No one really understands why really well. And it causes that the vulva, the skin becomes over time very thin and cigarette paper-like and, tears very easily with intercourse and is very itchy. Usually a condition that older women develop, but we also see it sometimes in very young girls. Poorly understood what it is. We only know it's some type of autoimmune reaction, and it's usually treated with cortisone, right? So, and that might work well initially, but here again, you don't want to do this forever. And here's what I'm always going to ask for: where's this coming from? It's an autoimmune reaction.
Exactly.
Is this like a food sensitivity that is triggering that? Where is it coming from? So that is that lichen sclerosus. Then there are rarer things like lichen planus. It's more in the vagina. I don't want to go into detail. They all differentiate a little bit. Then desquamative inflammatory vaginitis, DIV, is rather rare. And I also poorly understood. We only know you hear that inflammatory in the term, so in desquamatory, so that means there are a lot of shedding cells. And when you look at the discharge, it looks there are a lot of inflammatory cells in there. So these women, as you can now imagine, it can be a burning. It's a condition where you have a burning vaginal discharge, and that can also be painful with intercourse. So that's the DIV. Again, has to be you have to separate that from BV. Make sure it's not that. Someone might be treated forever with recurrent BV, but maybe they have actually DIV. So I think these are the big major ones. Oh, one thing we should not definitively mention. So as we get older, there's an increased risk of vulva cancers. Okay, and these don't come out of the blue. These are lesions that develop really very slowly. But if you don't pay attention and the woman is saying, oh, this is just itching here, and she gets like, recurrent yeast infection prescriptions from her primary care physician or maybe even gynecologist because they don't look really well. I have definitively seen vulva cancers that have been treated for a long time, with yeast medication. So again, go to someone who really likes to look at vaginas, okay? Who takes their time, really, puts on their glasses and really checks out very well and, asks you exactly where it itches. I always ask my patients really, I like take one finger and, because patients come and they're like, oh, it's all, they're so upset because everything is raw, and I do understand. But sometimes I want to know, if I give you one finger, where's the worst location? And that often helps me to zoom in to that area. So
Yeah. Okay, so that was a really good breakdown. So, if you guys are dealing with potential vulva issues, like Dr. Christina mentioned, it's worth getting checked for lichen sclerosus, lichen planus, and everyone pronounces it differently. I don't even know how it's pronounced myself. Also, DIV, GSM, which is the genital urinary. Oh my God, I forgot
syndrome of
the
menopause.
acronym. Yes, yes, GSM. And then I think there's one more that I'm forgetting. Lichen sclerosis, lichen
No.
planus, DIV, GSM,
Yeah.
and vulva cancer.
Yeah. These are the most important ones. Yes.
Okay, so with these types of infections, how are they different from the more, or if there is a connection, how is these different more from like BV or yeast or like aerobic vaginitis? And also, what are the different causes of these skin conditions more so than the internal vaginal infections or imbalances?
Okay. So the way I would describe it to any woman is like the BV and the yeast infections, right? Which are like dysbiosis, or yeah, we call them vaginal infections. Even I don't like that term, right? Because you hear what
Yeah,
I'm
me
saying.
too.
Well, there is, because women are coming and they do, I have an infection, and infection, everyone gets a panic. And I'm like, well, let's take a deep breath. This is a shift in the vaginal flora.
Yeah,
And this is the differentiation. It's not a disease, right? BV is not a disease. As terrible as the symptoms might be and as disruptive, this I acknowledge that it's not a disease. There's not as far as we know, there's not an autoimmune. I don't believe that. There's nothing autoimmune,
yeah,
nothing deeper really sitting. It's a recurrent often recurrent, frequently recurrent change in that vag or shift in that vaginal flora. So other big, many bacteria living in the vagina, hopefully mostly lactobacilli in the extremely healthy vagina, but there are a couple of fungus, is also a couple of, candida is living often there together with other bacteria. So I'm always saying the other ones, the moment they get a chance, they're going to take over their place. This is just how, it works in the Wild West. And lactobacilli is that one that we would like to promote the entire time that we are at least younger, because it keeps these other guys out, and it also decreases our risk of to get STDs, for example. So the lactobacilli really do many things. It prevents ascending infections. So basically, with this, I mean pelvic inflammatory disease, right? So if you have always this not so good shift in the vaginal flora, we know you have an increased risk for pelvic inflammatory disease. We know these women have an increased risk for early pregnancy loss, right? And that's the reason is it's that infection, right? It's kind of, it's infecting the uterus. You just have to think the uterus is not a closed system. It's connected to the vagina, and the vagina is connected to the exterior. So the vagina is really that funnel there that needs to keep everything that, comes from outside that shouldn't crawl up there, has to keep it out. And,
Yeah.
and the mechanism is really these lactobacilli when we are older to really keep our uterus protected. Um, did I answer your question? I
Oh,
don't.
yeah. So I wanted to ask more about like for these skin conditions, like what are some of the causes, like in terms of maybe diet or the fabrics, or like you mentioned, autoimmune disease for
Yeah.
lichen sclerosus. So what are the causes and what are some ways women can get tested for these things? Those two
Yeah.
questions.
Okay, so here I want to clarify. So there's one, the conventional aspect, what we know about it, which is not much. And then there are things that I think and I've seen in my clinical experience. Okay, so this is not written in stone. However, so like lichen sclerosus is an autoimmune reaction. Conventional medicine doesn't know why, period. So we don't know. Okay. However, do you need a functional gynecologist to diagnose? No. I think lichen sclerosus, many more interested gynecologists can diagnose that. And there are also, other vulvovaginal disease specialists. There is a website from the International Society for Vulvovaginal Disease, and there you can always look, to look for someone in your area.
Oh,
Um,
okay.
yeah, so these people are out there, okay? So yes, and they're not necessarily functional, but they can diagnose these things. And they're gonna go through some standard treatment first, which there's nothing wrong with many of these things. So that's the lichen sclerosus. Genitourinary syndrome of menopause, I explained. Underlying mechanism is really the deficiency of estrogen to these tissues. And that I think that's the best one because you really can treat this easily with vaginal estrogen. If I hear that this is, someone says, oh yeah, my doctor gave me estrogen, it doesn't do nothing. Really here's the take home message. You need to take enough. And it always depends, where that woman is. She just, oh, I have a little dryness. If you take some vaginal tablet 3 times a week, that might be enough. But someone who really has, the penis can't even enter anymore. Everything is tight outside and inside. It feels like the vagina is too short. Your little tablet 3 times a week is not going to do it. Then I always say you have to up estrogenize these tissues. So basically hit them hard for at least 3 weeks. And with this, I mean, if the pain is outside and inside, I actually like the cream because the estrogen cream you can really put outside, squeeze inside, so all the tissues are really getting maximum estrogen exposure. And then I say do that for 3 weeks, and after that you can space it out to about 3 times a week. And then make sure when you have the first time intercourse, if that's what you want to do, then have a good lubricant, and then stretch these tissues again. So the tissues need estrogen, but they also need to be used. So, because people are asking me, do I have to take this now forever and how much? And I'm like, well, it depends. If you now have regular intercourse every night, maybe you only need that, like twice a week or even less, because with intercourse, these tissues get stretched and perfused. So there's some more blood supply. That all helps. If you have a boyfriend and you see him once every 6 months, right, you will have to to basically give your vagina some more estrogen continuously to be ready when it comes to that event.
Yeah.
So yeah, I mean, and the other one you said DIV, completely poor. So the desquamatory inflammatory vaginitis, where we have this inflammatory discharge, completely poorly understood. Um, I'm so that's really, and we use usually some vaginal antibiotics and cortisone to calm. Basically, it's like to put a lid on the problem, right? To treat that
Yeah.
symptom without really understanding. Here is, I personally would definitely look at the how the gut microbiome is doing at the same time. You have to understand the vagina is adjacent to the bladder, is adjacent to the gut, literally. So if
Yes.
these, and we know this, if we have, women with IBS or the way around, women with endometriosis, we know have IBS often, right? They have intestinal
Yeah.
cystitis, which is the painful bladder syndrome. So we always know they run in threes. But the question is like, why? Well, because it's not just one organ sitting there by itself. If one of them is angry, the other one usually is angry too. And for me, it makes perfect sense to say most likely it's a similar problem. It has something to do with inflammation, most very likely mucosal breakdown. Is this now the gut? Is it the gut mucosa? Is it the vaginal mucosa? Bladder mucosa, same thing. Painful bladder syndrome. What do you think it is? We know it's that bladder wall gets leaky literally. So when we give this Almiron, it's a medication. What it does, it seals that bladder lining again. So it's like, in my mind, it's always the same concept. And the question always is it microbiome issue? And with this usually comes the mucosal barrier breakdown. Is it inflammatory? And then, autoimmune. Autoimmune usually happens once you have these mucosal breakdown. So it's a
Yeah.
downstream effect. So that's how I see it.
So it can be either like a microbiome issue, an autoimmune issue. Um, okay, so yeah, so that makes sense. Okay, so what about because a lot of women they believe that sometimes these vulva conditions are caused by maybe their laundry detergent or what kind of underwear they're wearing. In your practice, do you see sometimes where women develop these conditions basically just from the clothes that they're wearing or anything like that?
We always teach that, right? And this is always that thing like, wear your cotton underwear and,
Yeah.
your laundry detergent. I've not had one case where this was really the problem, right? Do I like synthetic underwear? No, I think it's probably, get something that is airy. But if this is now a nice airy lace or this is really like cotton, I'm not sure if this really makes that big difference. I think this is a lot of maybe a little misogynicity like this, or just
Yeah.
keep air down there, like again, like this is like this unhealthy musty air. I don't know, I'm just not into that. I just don't think, I never really saw this as the main problem. So you said like,
Yeah.
the underwear and the detergent. I mean, yes, if you have a very abrasive detergent and you wearing a thong and this is like rubbing in your vulva the entire time, but then I see 1,000 other reasons why your vulva might be irritated. So I don't think that is the main reason. Can it happen? Yes, right? So we know these state phthalates. So these are the biochemical compounds we have in all most fragrance products. So I know like the industry is heavily marketing again, like the scent beds and that your laundry should smell fresh like for 4 weeks. These are actually environmental toxins, right? So if you
Yeah.
want a very strong, laundry softener, can it irritate your vulva skin? It's possible, absolutely. Do I think it causes BV? I don't know. I would say I'm agnostic. It's possible. I haven't really, I definitely hate phthalates for many reasons, from the
Yeah.
inflammation to the brain fog, hormones. So, yeah, maybe now that you're asking me like this, yeah. I just never had like really scented laundry detergent, so I can never really imagine. But I hear always the ads on the radio, and I'm like,
Yeah.
okay, flaky scent beds. I'm like, who needs that? Except companies making money. That is the only reason anyone might need that. But
Yeah. Yeah, so what I tell my clients at least is that when your vaginal microbiome is strong enough, because you can view it as like its own immune system,
Yeah.
then these external things won't necessarily impact you. But when you have a weakened vaginal microbiome or weakened vaginal immunity, or whether even the actual skin barrier is damaged or weakened, then you're more likely to be reactive to external things like the
You're breaking up. I don't hear you right now, Dakira. You turned it off. Yeah. Here you go. No? I think I
Gotcha.
hear you again.
Okay, can you hear me?
Yes, I can hear you again. Yeah.
Okay, yeah, the microphone died, but I always tell women that when your vaginal microbiome is strong enough, you're not so impacted by external things. But when your vaginal immunity is weakened, then you're at an increased risk to be reactive to detergents or different underwears, sex, and then you're at an even increased risk for getting vaginal imbalances or infections and stuff like that. So I like
That
your
is
point
my
on that, and
favorite.
it makes sense.
And I also, that's something what because women are when I'm coming with this, you have to stop your bar soap and the Dove and the dial, and they're like, "What?" I'm like, "Look, yeah, I know your grandparents used that, but they took like a
Yeah,
full bath, like what, like once a week or so. Fantastic, and no problem. But you're taking like a shower with, like 3 times a day, and then you take your loofah and you kind of make this whole foam bath every time and rub it into every crevice. That's when we get problems. So that is the same concept.
yeah.
It's just too much.
Exactly, yeah. So, on to the last question. For women who are dealing with these vulva vaginal conditions like the ones we talked about in this episode, what are some solutions? Because on your website, you talk about how you do a lot of functional lab testing and how can women get to the root cause of these issues from a more functional, holistic standpoint? And then what are some common solutions that you help your clients that deal with these specific conditions?
Yeah, absolutely. So first of all, I find like many people I basically cure by removing these external irritants. And I'm sure you do that too, right? So once we stop the
Yes.
bar soap and I tell them what to use and how to use and throw all their wash rags away, all of this, I would say 80% are fixed with that. So basically me doing nothing except talking and convincing them, right? Because usually then they come back and then they still use the soap somewhere else. So we have to reinforce. So that is first, right? And
Yeah.
then, let's just talk about recurrent BV and recurrent yeast infections. So, because these women come highly symptomatic. So there is something I do initially for both of these. So BV, I do use vaginal metronidazole. And the idea is I use it, it's a 6 months protocol. So I tell them use it once a month for 5 nights, 7 nights, sorry. And this is really to first to get bump this bacteria away. But now for the rest of the 3 weeks, I want you to do something to let the good bacteria grow again. And that's when I like from Good Clean Love the Restore gel. And it's a lactic acid gel that was actually formulated originally by Dr. Richard Cohn. He was a vaginal microbiome researcher from Johns Hopkins University. So, and we actually still doing studies trying to show this is actually able to avoid recurrences. So anyhow, so the idea is once a month you really try to hit the BV causing bacteria on the head, and then for the rest of the 3 weeks you support the vagina, make sure the good bacteria are coming back, and you can combine that with a vaginal probiotic. And I do that for usually 6 months. If someone gets better before that, because in combination with the stopping the bar soap, they get great, fantastic. And I do similar for yeast. So again, yeast can be terrible, right? So, first of all, just I do very good vaginal nucleic acid amplification. So whether BV or yeast, I really look exactly what's going on there. I want to improve what is actually there. If I can, I do it in combination with some very old-fashioned yeast cultures, because they actually give me, I say they're dirt cheap. No one does them, but they actually show me what is that yeast sensitive to. Yeast, resistances against antifungals for yeast was rare, but we see them now more and more, and they are kind of, it's a continuum. It's not like this medication like diflucan doesn't work at all, but it doesn't work very well. So then, and it's pretty, compared to other antifungals, it's rather innocuous, I want to say, as
Yeah.
innocuous. So I don't dislike it, but then you have to know it's not the strongest for this type of yeast that this lady is having. Well, I have to use it longer. So I never give one-time doses. If I give it twice and then I repeat it for another week, for another 3 weeks, just to really make sure we get this yeast under control. Why, again, I try to with, pH vaginal gel and good probiotics, sometimes oral probiotics that are supposed to be good for the vagina to help that out. So yes, so yeast, same thing, up to 6 months. Um, I'm not a big fan of oral treatment for BV, like, the oral metronidazole. I'm very rare, okay? And the reason is because you're killing the entire microbiome every time, in your ears, in your gut. Like, why? You have this imbalance issue. So in that regard, I like the vaginal metronidazole gel because overall it's pretty harmless. What people need to know, the metronidazole gel goes in as a clear gel, but it's going to be metabolized by the bacteria. They're living in there. They're happy. So it's going to come out looking like a clumpy white discharge. And that's why many women think, oh God, I got now a yeast infection. So I say, well, it's possible. But if it's not itchy, it's most likely just that metabolized gel coming back out. And it can come back out, I would say, up to 2 weeks after treatment. So always keep that in mind because otherwise, we are freaking out. Now we are grabbing the next, now we grab the antifungal, right? Maybe a cream vaginally. And then once you do this long enough, then you get this post-treatment inflammatory vaginitis, how I call it, right? When
Yes.
that's not a real term. I really invented this. I'm probably gonna write a
Yeah,
book.
no, yeah, me too, actually.
Yeah, there you go. Should do it together. That's really when the vagina just doesn't want nothing. Then nothing you put in there anymore, everything is going to burn. And that's again, then we have to I sometimes even have to use, let's say, oral estrogen. So in women, let's say they have a part of it is vaginal atrophy, then, I can't put nothing in the vagina. Then sometimes I have to give it literally orally or, do a patch, give systemic hormones just to calm this down. But a lot of it's really telling people to not rub more, to just let it be, because again, the body wants to heal. So we just have to give it a moment.
Yeah. Okay, so thank you for answering all of that. If you want to briefly explain how they can use the functional test you offer in your practice to get to the root cause of any of these conditions.
Yeah. So I use actually I'm about to use a new test. So some of these things I do offer online indeed, because I send it to your house, you swap your vagina. I mean, science is fantastic. So I'm just starting to use with a new test, and now is a good time to contact me. So you do it at home. Gives me a full array of the microbiome, of disrupting bacteria, of the normal ones, and then it comes with treatment approaches. Sometimes we give hyaluronic acid. So there are many things depending what's really going on that can be treated. Sometimes, I need to see people in person. However, I really learned in my years in practice that many things are for me so simple because just other people never approach it the right way. But if I get like a good, vaginal swab and really understand what's going on in your vagina, that can be like 90% of that healing. And then, however, I do combine that depending how severe that is and if there are other, how long it has been going on, if there are symptoms in your bladder and in your gut, that's when I then, always suggest to also do a gut microbiome or gut health test because it checks actually also like for gut barrier breakdown and food sensitivity. So I have found like these three can be tremendously effective to really understand what's going on. It also is fantastic for lichen sclerosus, for these localized vulvar skin eruptions that no one understands what it is. All of that is very well served with some of these tests.
So the functional test, just to make it clear for the audience, can help women that do deal with lichen sclerosus, lichen planus, DIB, things like
Yes.
that. Those tests can help them to get to the root cause. And then with those conditions, what are your normal solutions for those specific conditions? If there's like a general, I know it's not general, it's very individualized, but for audience members who want to speak to their GYN or they want some kind of guidance, what would you say is usually the line of treatment for like the lichen sclerosus, planus, DIB?
Yeah, so lichen sclerosus is a high potency topical, so cream or ointment steroids. Okay, so this is really to suppress what's really going on, the symptoms, which is not bad. I start with that too, because otherwise, you just have to start with something and then trying to figure out what's going on. For DIV, it's a combination, often compounded. It's intravaginal antibiotics, clindamycin, often together with intravaginal cortisone, because these women are so symptomatic. You just need to hit this local immune system on the head to calm it down. And then, for BV, I mentioned it. I like I would, if you are a listener, ask your gynecologist to please give you the vaginal gel. I know some women don't want that, but now you know why this is actually the better solution than the oral one. And for the yeast, um, I haven't mentioned that, so thank you for asking.
Yeah.
While I do diflucan often, I have to say the vaginal preparations actually work better. So again, because otherwise you take a tablet and it has to be cleared by the liver, and with some luck it arrives in the vagina, and it does. But why shredding that through your liver if you tolerate it? Like, I like the lower dose. So the one day treatment, yes, that is of course convenient. However, it works much better if you take a lower dose and you take it for 7 days, like the Terazol, the zero point 0.3, it's for 7 nights. Don't be inconvenienced by that. This has a much better clearance of vaginal yeast infections than the oral ones or the shorter courses.
Yes. Okay. So thank you so much for answering all of those questions. If you want to tell the viewers how they can work with you or where they can learn more from you.
Yeah, so you can find me on my website is drchristinaenzmann.com. There's also a contact form you can fill out. Just send me a message. I'm rebuilding right now that vaginal part really. So check it out. Send me a message. I'm always I would love to connect with you, ladies.
Yes. So if you guys are more into that medicated approach, you can definitely check out Dr. Christina. But otherwise, it was really nice having you. Thank you so much for answering these questions. And I will see you guys all for the next podcast episode. Bye, everyone.
Bye bye.